if anybody has any kind of potentially terminal illness, disease, I think that they should be talking about this early and often. We're working now, I'm on the palliative care committee at the hospital, and we're working now with identifying those patients that would most benefit from early intervention with a palliative care consultant. They have physicians, PAs, nurse practitioners, chaplains, social workers, all that. So early intervention with those folks is going to be so important. You don't have to go tell somebody they're going to die. You're going to say, hey, listen, you have this advanced lung disease. And there's a few things we can try, and we can make you feel better, and we can do things potentially for a fairly long time. But this lung disease isn't fixable. So instead of doing things when it's an emergency, when you're not feeling well, we like to get people in these conversations with either their primary care physician, a palliative care consultant, and say, it's your life. Now's the time to talk about it with your loved ones, make your plans, make your wishes known. It doesn't mean that what you say today you can't change, but it's good to get that conversation started early. I think that I see far too many patients and families, in my opinion, doing aggressive measures, interventions, putting tubes and lines and things in patients who it is not going to change the outcome for. You know, if it's going to have a chance of an improvement to either quality, quantity, whatever the patient wants for their life, that's different. But there's some patients who, no matter what you do, the outcome is going to be that they're going to die from the illness they're there with. And they're going to die very soon. And we haven't communicated enough to the people who are making the decisions what that looks like. I've talked to families and talked about goals and hope, and said sometimes your goal and what you hope for just needs to change. So although you had hoped to get a complete recovery and you had hoped to go home, that may not happen, but what other hopes do you have? And how can we help you reach those hopes? Maybe it's to be pain-free. Maybe it's to see a relative they haven't seen. Maybe it's to get home one last time, even if they know that the outcome is going to be that they're going to pass away. So we just change that hope sometimes.